I'm Barbara Epstein, Director of the University of Pittsburgh's Health Sciences Library System, better known as HSLS. Our library offers support and collaboration for the university's 6 schools of the health sciences. In this inclusive environment, we offer a wide array of information services, educational opportunities, and resources in print and electronic format. Our virtual and online services are featured on the HSLS website, and our physical home of Falk Library provides spaces to study, collections and exhibits to engage our visitors, and day-to-day support for questions and assistance within the health sciences community. It's my privilege to introduce you to our featured historical collections from our Rare Books room.
The Rare Books and Special Collections at HSLS consist of more than 10,000 medical texts and artifacts published as early as 1496, as well as print and audiovisual materials of local interest, which span more recent decades. Founded in 1883 in conjunction with the chartering of Pitt School of Medicine, the library's collection began with contributions from the first faculty members of the school, and has grown to feature an international array of sought-source materials. Today's historical collection, housed in Falk Library at Scaife Hall on Pitt's Oakland campus, brings together rare books from the former libraries of Pitt's Schools of Medicine, Dental Medicine, Graduate School of Public Health, Nursing, Pharmacy, and the UPMC Western Psychiatric Institute and Clinic. The collection does not normally purchase new artifacts, but donations of private collections have contributed to the continued growth of this unique collection. The collection is available to students and faculty, as well as the public by appointment. In 2019, a new space was created in Falk Library to house the collection and ensure the preservation and longevity of the materials it contains. Dr. Gosha Fort, Head of Digital Resource Development, manages the organization, access, and preservation for Rare Book and Special Collections. In her role, she also oversees web-based and digital projects which increase the visibility of library historical collections. Gosha has been a part of HSLS for over 20 years and frequently shares collection highlights with the Pitt community through the HSLS Update newsletter. Today she will be featuring select items from the collection rarely seen by the public. We hope you enjoy this episode of Medical Treasures of the Health Sciences Library System.
Episode 3, Musings on Manuscripts.
A manuscript, generally speaking, is a text recorded by hand, no matter what writing system, what materials or technique were used to create it. Before the invention of print, handwritten copies were one of the basic means of disseminating ideas. Each manuscript is unique. The earliest manuscripts are in the form of inscriptions on stone, clay tablets, and scrolls. They are usually kept in museums. Today we use a slightly narrower definition, according to which a manuscript is any text recorded by hand on a soft material like parchment or paper, using any of coloring substances. This definition also includes typescripts made manually with typewriters because they are unique, unlike photocopies and publications, which are produced through mechanical means in multiple copies. Today's manuscripts exist in many forms: codices, illuminated manuscripts, documents, journals, and diaries. Our library does not own any original manuscripts written before the invention of print, before 1440, though we have a few facsimiles, which are the exact reproductions of originals. The manuscripts I'm going to present today are much younger. They were created in 19th and 20th centuries. Unlike many published materials, they are unique. Let's start with Erikson manuscript. Erik Homburger Erikson, a German-American developmental psychologist and psychoanalyst, is famous for his theory of stages of psychosocial development and for coining the term identity crisis. He moved to the United States in 1933 and began working as a child psychoanalyst. He held various teaching positions at Harvard, Yale, and Berkeley. He was a visiting professor at the University of Pittsburgh in the 1950s. During his stay in Pittsburgh, Erikson worked with Benjamin Spock and Fred Rogers and frequented the Western Psychiatric Institute and Clinic Library. No wonder that he offered to one of our former libraries an early version of his noted work, Insight and Responsibility, published in 1964. The manuscript consists of printed and typewritten pages of his earlier essays and lectures, each penned with changes and revision, as well as handwritten pages of completely rewritten sections and new additions. It clearly shows how Erikson changed his earlier writings for inclusion in his book and illustrates his writing process. The manuscript is housed in a specially made wooden box. Each chapter is stored in a separate envelope. Erikson's manuscript allows us to see how the published version was born. The next example is a group of typescript manuscripts, all from the World War I era. The first of them is the typescript copy of the manuscript written by Dr. Stanley Smith, describing the university-based Hospital 27, which was formed and operated by the University of Pittsburgh in Angers in France in 1917 through 1919. At the top of this document, we have an explanatory note which reads, "The following is a copy of the manuscript in the possession of Mrs. Stanley Smith. Though it is unsigned, it is said to be in Dr. Smith's handwriting. At the time this copy was made, it was the only known historical document relative to the university-based hospital available to the archives of medical school." So we understand the importance of this little document. Later, the library was able to acquire also two other documents from the family of Dr. Robert Miller. His War Diary of Base Hospital Number 27, AEF, standing for American Expeditionary Forces, as well as his scrapbook. Dr. Miller was a professor of surgery at Pitt and an organizer of the University of Pittsburgh Base Hospital. His diary contains other typewritten reports illustrating how the unit operated and functioned, including the history of the hospital. The scrapbook includes handwritten and typewritten orders, statistics, letters, maps, menus, and other materials documenting his life in this unit. All three documents are very fragile, especially the scrapbook, which shows discoloration where the glue was used to mount the documents. All three items are great candidates for digitization to preserve this unique record of Pitt's participation in First World War. The involvement of School of Medicine faculty and alumni in the war effort was so wide that University of Pittsburgh published a special bulletin in 1919 to list all those who served. Another war-era collection of local interest relates to Pitt faculty's participation in the medical service of the United States Army during the Second World War. The organizational structure of military hospital during this period was very different from the previous war. General hospitals were among many other hospital types: field hospital, station hospital, evacuation hospital, portable hospital. It is purely coincidental that Pitt faculty were involved in two different hospitals with the same number during two different wars. This mini collection is a set of 2 volumes and a box of 33 glass slides describing the construction, organization, service, and life of the 27 General Hospital in New Guinea, which operated from July 1944 to July 1945. It was the farthest forward of all general hospitals in the Southwest Pacific Theater. It cared for more than 21,000 patients, mainly American Army personnel, but also Australian sailors, local civilians, and Japanese prisoners. Among the medical staff were doctors with affiliation at the University of Pittsburgh: Dr. Leonard M. Monheim, Dr. John J. McAleese, and Dr. James R. Watson. The provenance of these volumes is not well established. It was probably Dr. Watson who compiled these volumes and donated them to the library. The reports in Volume 1 describe in detail the activities in the hospital. They also include a mixture of items: photographs of the camp, charts and drawing, maps of the camp, hand-drawn and hand-colored illustrations. Of special note are the detailed medical reports that discuss, for example, types and numbers of operations, number of patients, incident of wounds and mortalities, and the detailed discussions of treatments for non-surgical patients. Dental and psychiatric services are included too. Volume 2 contains surgical reports, papers written by staff doctors on various medical procedures or treatments, and 28 detailed autopsy reports. The text in both volumes consists of type carbon copies on lightweight paper, hand-drawn and colored ink and watercolor sketches that serve as frontispieces for each bound volume were created by a technician 4th grade Maxim B. Gottlieb. This interesting mini collection was turned into a digital exhibit and can be viewed from the HSLS website. The full set of photographs is available online as well as excerpts from the surgical and quarterly reports. The next 3 manuscripts I want to show are all handwritten. None of them was written with any intent to be published, though some of the letters ended up in print. So let's start with Horace Wells' letters. Horace Wells was an American dentist who pioneered the use of nitrous oxide in tooth extraction. He was posthumously honored as the discoverer of modern anesthesia, first by the American Dental Association in 1864, and then by the American Medical Association in 1870. There was no greater promoter of Wells' contribution to the development of anesthesia than his main biographer, WWII Archer, who not only graduated from Pitt, but was a lecturer in the School of Dentistry and later the head of the Department of Oral Surgery. During his years at Pitt, Archer helped to build an outstanding collection on the discovery of anesthesia that primarily focused on Horace Wells. The collection included letters, instruments for delivering anesthesia, portraits, books, journals, and pamphlets. This collection of Wellsiana was the most complete in the country at the time, and the Wells family letters were its highlight. Archer obtained the letters for the collection from Mrs. Arthur Cole and from Miss Wales, both relatives of Horace. During the reorganization of the dental school library in the 1970s, the collection was broken up. Archer donated his anesthetic armamentarium and miniature portraits to the Smithsonian, while the rest of the collection was divided among Pitt's University archives and our library. Our collection has the majority of books, journals, scrapbooks, and letters. We have 16 letters written by Wells himself and 15 letters written by other members of his family. Some of Wells's letters were published by Harry Archer and quite recently by Emily Bunker. Digitization efforts have begun with this collection, with details currently available in a finding aid on our website. The original letters are properly cared for and stored in our rare book room. The next item of interest is a volume of handwritten notes from the lectures of the British surgeon Sir Astley Cooper. Although Cooper himself is very well known, there is much unknown about the details of this particular item, including any reference to the dates and place where these lectures were given. Sir Astley began teaching surgery at St. Thomas' Hospital in London in 1791, and later he was also a popular lecturer at the Royal College of Surgeons in London, beginning from 1813. I think that the notes are from those later lectures. In the lecture on hernia, he refers to his own works on hernia, which were published in 1804 and 1807. But it is obvious that some time has passed since then, because he gives greater number of known cases than what was published in those works. There are 56 lectures recorded in the notebook. It is roughly equivalent of 4 semesters. Even the individual who wrote the notes is unnamed. The handwriting is so neat that the notes are most certainly not a rough draft, but a later purposeful transcription of one. Though so much remains unknown, there are some clues in the notes themselves. Some phrases used indicate definitely that the note taker was present in a lecture hall. We read, Mr. Cooper was of an opinion, or Mr. Cooper related a case. Mr. Cooper spoke highly of. The lecturer was not only sharing his knowledge and experience, as in a phrase, Mr. Cooper seen it happen in an infant, but also provided some demonstration, like in a phrase, Mr. Cooper produced a specimen of a child having 2 additional joints, or Mr. Cooper had a live rabbit on the table. And he also performed some surgical procedures. Mr. Cooper has opened the bladder by merely pushing a lancet into it. The notes give us also a glimpse of the teaching methods and show us the dangers of the profession. In the lecture on poisons, we find that Mr. Cooper, having some vipers on his table, was bitten by one. Therefore, the students had an impromptu demonstration how to deal with the poisonous bite. The notes are handsomely bound, and they come from Dr. Mark Ravitch's collection of hernia, donated to the library by the Ravitch family in 1980s. My final example is a set of several century-old patient ledgers from what was then called Presbyterian Hospital of Pittsburgh. The 10 volumes date from 1895 to 1924 and correspond to the early years in hospital history, when it was still located in the old building on the north side. The ledgers were found in the current hospital's location in Oakland during the last renovation project and were recently incorporated into the library's historical collection. All volumes are handwritten in multiple handwriting styles over the year. Each entry includes patient name and address, age, date of admission and discharge, the duration of stay, occupation, religion, ethnicity, nationality, diagnosis, and the outcome. They could be a wonderful resource for longitudinal and historical studies of morbidity or mortality in the area, or its correlation to socioeconomic status, location, or age. They capture some statistics for the 1918 influenza outbreak in Pittsburgh too. These ledgers, as historical resource worth preserving, are now properly stored and cared for. Digitization efforts are underway to make some of the valuable information in these records available to researchers. If you enjoyed the current presentation, join us for the next episode, Anatomy with Italian Twist, during which we will look at some of the anatomical atlases in our collection. If you have any questions about items presented today, please feel free to contact me by email at gosia@pitt.edu.